Well, welcome to today's Meet the Healthcare Professional presentation, sponsored by the Center for Healthcare Careers of Southeastern Wisconsin, in partnership with Advocate Aurora Health, Ascension, Children's Wisconsin, and Freighted Health. As a reminder, please mute your computers or your phones so that we don't hear the sounds behind you and don't get any feedback. We will have the ability for you to enter in chat informations if you have information or questions in the chat function if you have questions that come up. My name is Devonna Williamson, and I am a talent business partner with Freighted Health, and I am going to be your moderator for today as we speak and meet with our representatives talking to us about the medical lab profession. We have Nicole Leon and Katie Kuntz. You have a new name now online. Ladies, could you introduce yourselves, please?
Yeah, I am Katie Kuntz. I work at Children's Hospital. I've been here for about 6 years, in this profession for about 10 years. And I am the microbiology team lead.
Happy St. Patrick's Day, everyone. My name is Nicole Leon. I'm the histology team lead in laboratory. I have been with Children's 11 years, and I have been in the histology field for 22 years.
Thank you so much, ladies. And I apologize, I forgot to say you're from Children's. I failed that part. I was struggling with my technology here. So, having introduced yourselves really quick, Katie, Nicole, is the role that you've held at Children's the only role you've held in healthcare, or have you held other roles?
I have pretty much been in the microbiology department career pretty much my whole 10 years. So I've kind of switched from like a bench tech, a med tech, to like a team lead supervisor position, but in the same general area.
Okay.
And I too have been in histology for 22 years. I started out as a bench tech and worked my way up through leadership and have been in a leadership role for about 17 years now.
Okay, great, wonderful. Thank you so much. So, ladies, tell us a little bit about what an average day is like for someone who works in the medical lab field.
Yeah, so microbiology, as you can tell by the name, micro is everything you can't really quite see with the human eye for biology. So we do everything from bacteria to viruses, to molds and fungus, to acid-fast bacilli, which would be like tuberculosis, and immunology testing, so IgG and IgM testing. And so for the med tech and the microbiology lab, you never really know what you're going to get from day to day. It's kind of different from day to day. So our benches, we do most of our work is bacteriology, so working with bacteria. Depending on the different sources that we get from samples from patients, it depends on what the organism that's growing is, what type of bacteria, and from what type of source. So our benches are separated out by source. So we have, and we call it benches, like a bench is like a workstation. So we have a respiratory bench that does respiratory cultures. So that tech looks at all the respiratory cultures for that day. They look at we set up media plates. So they look at our media plates and they decide what kind of pathogens are growing. Pathogens are organisms that cause infection. And then they see what type of other non-pathogens, or we call it normal respiratory flora, are growing too. So they isolate our pathogens, and identification methods are performed, and they do susceptibilities. So they do antibacterial testing on the pathogenic bacteria to see the susceptibility patterns for those. So if an organism is resistant or susceptible to a different antibiotic, so the physician knows what antibiotic to prescribe the patient to help their infection. And that's kind of the base of all of our benches. So we have a respiratory bench. We have someone that works up just urine, so they do the same thing. They pull out the urinary tract infection, the pathogens from there, so deciding which bacteria causes infection, and then which antibiotic also to prescribe to help with the infection. And then we have a blood culture and a spinal fluid culture bench, and then they do the same thing, pull the bacteria and decide which antibiotic to prescribe for the bacterial infection. And then we have a different bench that just does wounds and skin cultures and all the kind of other random sources. So the techs spend most of their day at the benches looking at the plates, pulling out the pathogenic bacteria and setting up susceptibility methods. And then we do other, tests that associated with that too. Like we have molecular PCR testing, which right now we do COVID PCR testing. So that's a very high volume test that we do right now. I think Children's just reached 50,000 tests this year since this has started. So we do a lot of COVID testing here. And then other PCR testing, like we do like group A strep. So if you have like a throat group A strep infection, we do that. And we do CMV and EBV testing. So some of viruses that we have. So we have a broad testing catalog for PCR. And then also like influenza as well. And then virology, we do virology cultures. So just instead of PCR, we do manual culture methods for some viruses. We don't do COVID viral culture testing, but that's only by PCR. And I'm trying to think what else we do. That's the majority of our testing that we do. So that's kind of the average day for the bench tech. And then we have miscellaneous other duties too that kind of go with the benches, like different identification methods for the bacteria and different susceptibility methods that we do to set up the antibiotics. So that's kind of the main day for a micro bench tech.
And so for histology, much like Katie said, you never know what you're going to get. From one day to the next is a total surprise. And so histology is actually the study of tissue. So any organ or tissue removed from the body comes to our department. Tonsils, appendix, skin biopsies, GI biopsies, any kind of human tissue comes to our department. And what's very unique about a pediatric setting is we also take care of cytology, which is the study of cells. So any body fluids that would be collected, if you've got an infection in your knee and they pull a joint fluid or something, we process all of that. And cytology is the study of cells. And so in histology, we look at cells and we look at tissue. One thing I love about my average day is that I'm constantly on the move. I say that I really don't have to work out because I get a workout in my department because I'm just constantly moving all day long, which is really great. If you're a person that doesn't like to sit in one spot for a short amount of time, histology may be perfect for you because there are so many different things to keep you busy during the day. And much like Katie said, we also have benches in our department. And so we have 5 different benches. We have an accessioning bench. And so all of the specimens that come down from surgery get a unique identifier that follows the specimen through the whole process to where the pathologist actually looks at the slides. I actually brought a couple of blocks. So when I talk about blocks, we dissect the tissue into these very small paraffin blocks. And then we cut slides off of these. And when I was in my training eons ago, here's a slide that you can take a peek at. But what's super cool is that we are cutting that tissue in these blocks at 1/25,000th of an inch. So it's thinner than a sheet of paper. And wind is a histotech's nightmare because we're working with irretrievable samples in histology. So any tissue that comes to our department, you can't really get more of it, like you could get more blood or urine. And so when you're working with a very critical biopsy, it's very important that you keep the wind and the people walking behind you very, very limited, because that very, very tiny ribbon of paraffin that we create just flies away if somebody happens to walk behind you or the wind catches it. And so that's tissue that we can't get back. So, but it's a very exciting field. And we process our tissue. And so we embed these blocks, this tissue that into these blocks. They process through a processor. So we take all of the water out and through several different reagents to get it into wax, much like if you like to have a spa day and you like to get your hands dipped in wax, this is a little bit different, but it's the same kind of thing. And that wax makes this tissue stable for us to cut then these slides that I showed you. And so we've got a person that does the embedding. We have a person that does the cutting. And then we also have special stains. So when the pathologists look at their stains, there is a routine stain called an H&E stain. It's a pink and purple stain. And the pathologist will take a look at those slides and then have the ability to order additional stains. And so we have a special stain bench, which will, that person is responsible for doing stains for any special tissue components. We stain for elastic fibers, we stain for iron, fungus, trichrome stains to look at muscle and collagen. I'm trying to think. Basement membranes and kidneys. There are just all kinds of different special stains that we can do. And then we also have an IHC, immunohistochemistry bench, and that person is responsible for its antibody staining. And so we use an antibody to target an antigen in tissue to show us where a certain cancer or something may be metastasizing or coming from. We also do immunofluorescence on transplant biopsy kits so that we can turn those around quicker to start treating the patient quicker if they are showing signs of rejection, and to get them treated quicker than with our routine process. So things can be crazy. You really, it's feast or famine. You never really know what you're going to get. I was just telling Katie that the past few weeks in my department have been absolutely crazy, which is great for us, but may obviously not be great for the kids. But it definitely is a fun profession where you never know what you're going to get from one day to the next.
Wonderful. Thank you, ladies. You've talked about a lot of science and detail and everything like that. So what kind of training or education is actually needed to go into your fields?
So for microbiology, you need an undergrad, so a science major in microbiology, and then so you do about 3 years of college experience for that, and then your last year is rotation. So you rotate somewhere at a hospital in a lab, wherever you get assigned, through each department of the laboratory. So the laboratory, even though Nicole and I are only histology and microbiology, there's hematology, chemistry, phlebotomy, blood bank. So you get a rotation through each department through the labs. So that's what education you'll need for at least a microbiology med tech or any other med tech.
For histology, there's many different roles in the histology department. We hire lab assistants, and lab assistants need a high school diploma. Then there are histotechnicians and histotechnologists, and the histotechnicians require a 2-year associate degree and then have to attend a 1-year histology training program. I actually have I'm a histotechnologist, which is a bachelor level position. You need to have a bachelor's degree for a technologist position. And then in my role and in the team lead role, I believe that they prefer that 4-year bachelor's degree as well. And then moving up into a manager role, if that's something that you're interested in, they do require a master's degree. So I'm actually starting my master's this fall. So it's a little scary after being out of school for such a long time, but I'm going back. So, and then we also do have pathology assistants. If you want to assist the pathologist, some pathology assistants do autopsies, but they are a person that actually take care of dissecting the tissue and putting it into these blocks. We actually had 17,000 of these little blocks in 2020 that we processed, but they have a master's degree and they go through a specialized program for that as well. So there's many different opportunities within the histology department to find your niche and decide what you want to do.
Wonderful, thank you. So in talking about the roles that you do day in and day out and the various aspects of it, what would you say are the skills or abilities that would really be useful for someone thinking about these kinds of careers?
I would say kind of like Nicole already touched on a little bit. The laboratory is very fast paced, so you'll have to, you have to like working, and you don't get much downtime. So it's a good role for someone that is a go, go, go type of person. And I would say you have to be very detail oriented. We would deal with a lot of little microscopic things in microbiology, so you really have to use your talented eye to kind of pick things out that you want. And I think obviously you have to love science, and you have to love, you have to love what you do. So you have to, take some courses and see what you really like, and maybe what you don't like too. And I really do think that you have to be a caring and willing to go above and beyond for the patient here too. So those are kind of all the things that I think would be really helpful in this career.
To add on to what Katie said, I say ditto to what Katie said. But I also would add that in histology, you have to have very good manual dexterity. You have to be able to work very well with your hands, because like I mentioned, pulling that ribbon off a knife, that's 1/25,000th of an inch, you really have to use that attention to detail and have that manual dexterity. People will come in and watch us, and they're just fascinated by what we do. And we make it look easy. We'll say that. We make it look easy, but it's actually very, very difficult. And then I would also say that you have to have patience, because you never really know what direction you're going to get pulled in a day. Like I said, every day is like a new adventure. Some days are a little more adventurous than others, but you have to be patient, and you have to be willing to take the time to wait on physicians if you have questions about orders. We work with a lot of our pathologists in histology. They are in and interacting with us often, and sometimes their requests are difficult, and sometimes they don't come in at the best time, but you just really have to be open to whatever the day brings, because you never know what's going to happen.
Great, wonderful. Two more quick little questions. Would you say your role requires that someone be comfortable dealing with icky? And by that, I mean, okay, you guys understand what I mean, Is that another part of what's needed for this role?
Yeah, I think that's an excellent point to touch on. So, we get lots of different sample types from all over the body. So, obviously urine is not the greatest thing. You also have to think about, stool. You get a stinky poop that you got to deal with. That's not the most fun thing in the world either. We also get a lot of respiratory samples. So, sometimes the respiratory samples aren't the most pleasant thing to look at either. But we get, cool things too. Like Nicole, the tissues are, I wouldn't say they're icky gross. They're kind of cool to look at. We get blood. So I guess you can't be queasy. So we get blood as well. So we do get kind of gross things, but at the same time, you probably get equally amount of cool things too that you get to look at and experience.
And I would agree, for the tissue aspect of it, yes, histology can be gross. I'm not going to lie. I'm going to tell you flat out, it can be gross, but it's also super, super fascinating. The things that you are able to see in the human disease process it's wild. It's so cool. An example of, like we get amputations. So it's not uncommon to have a amputated arm or a leg. Colons, like Katie said, filled with stool, just there are gross things, but there are very cool things. And one really cool thing that I've seen that I'm always fascinated are ovaries that have kind of turned into their own little human being. When you open them up, they're tumors. You cut them open and they are very waxy inside, and they have hair just like you have on the top of your head. They have teeth, like the teeth in your mouth. We actually even had one that was growing its own brain, essentially. There was brain tissue in it. And so it's so fascinating to see the things that the human body can do when it's in a disease process. So I would say it's more fascinating to me than gross. There's some really cool opportunities to see some really cool things.
Thanks so much for answering that question for me. So are there any particular suggestions that either of you, both of you, would give to a young person who is considering a career in medical lab?
Yeah, I think my number one suggestion would be to get involved early. So we have lots of students shadow. We have a lot of even residents that come through for training, but even, people that are not in college and, high schoolers, if you want to kind of see what the lab is all about, get involved and contact someone. We have education coordinators that work with students. So get involved and just ask, okay, can I shadow for an afternoon or for a day? We're open 24/7. So if you have school during the day and you want to come in the evening, we're here. We're always here. So, and then we also have, like, kind of like Nicole mentioned, we have MLA positions. So you just need a high school diploma that we hire MLAs usually for the weekend shifts. So right now we have, students that are in college that have just a high school degree that are working for us. Even though they're doing their rotations and they haven't completed their college courses yet, they're still working in the lab. So they really have a leg up on, other students that are going to be going into the program. And I do think that, laboratory work is a good experience or good opportunity. Like if you don't want to be a nurse or a physician, but you do want to get involved in healthcare, it really is a good opportunity to kind of get your feet wet. Or if you don't know if you want to be a nurse or physician, you could start as a lab tech and work your way up. Kind of go through more schooling for that. So that would be my suggestion.
And the MLA, again, that's the medical lab assistant
Yes.
role? Okay, great. Thank you. Nicole, did you
Thank
have
you for
anything?
clarifying.
And
yes.
Katie answered that question very, very well. I was going to add one particular thing is just to say that if you're contemplating the medical field, like med school, going the doctor route, looking into being a physician's assistant, a really great opportunity while you are in school is to start working in the lab, because you're able to be exposed to all of the testing and the things that you would be using as you move forward in your medical career, as you go to be a doctor or a physician's assistant. And we want to keep people in lab because we don't want to lose them, but we do see a lot of people, a lot of driven people that come through lab and they start in the lab and then they decide they want to be a physician assistant or they're going to go back to med school. And so it's a really great foundation to start with. If you think you're maybe not ready for medical school, you can start in the lab and learn all about the things that happen behind the scenes in the lab, because we are responsible for all of that testing that happens. So when you go to see your doctor or you have your blood drawn, all of that stuff comes to us. And so we're kind of the hero in the background. We're the one that we do all the work and give your physicians and nurses the results back so they can tell you if you're good or if you need more testing or things like that. And so we're not out in the main scene, but we're doing all the work tirelessly in the back.
Wonderful, thank you. And you brought up blood draws. So phlebotomists fall into that laboratory. The people who do the blood draws, they fall into that lab world as well?
Yes, they do.
Okay, great, wonderful. So Nicole, I know you had said earlier, you had mentioned that one of the things you love about your job is the fact that you get to constantly be on the move and move around. For both of you, is there anything else that you enjoy about what you do? And you've touched on it a little bit, but.
Yeah, I think the number one thing that I love really, especially being a children's hospital, is how much we can really help the patient. Like Nicole was saying, the physician orders the test and then it comes down to us and, we're responsible for evaluating that sample or specimen or test and really seeing, what's causing the infection, or is this a healthy kid, or does this kid need more testing or more help? I think that's my favorite part, is just knowing that, all this work is really going to the greater good and that you're really helping somebody out there that needs it.
And I would add to that, Children's Wisconsin is definitely a very special place. I've worked in adult pathology for half of my career, and I've been with children's the other half thus far. But it is just a different work environment here. I say that here that I feel like my work has a purpose, because you've got these children, these innocent children that are born with these terrible diseases, and they've done nothing in their life to have these terrible things happen to them. And I really feel like the work that we do here is so special, and the atmosphere at Children's is just so different. And I absolutely love the camaraderie and work environment that we have here. We all get along very well. There's over 100 employees in lab, and we all know each other and see each other in the hallways. And it's just a really special place from whoever you work with. It's just special here, and it's a really, really great place to work.
Wonderful. Definitely takes an important person to dedicate themselves to caring for kids in any fashion. So definitely. Before the very last question, which is what do you like least about your job? I just want to remind everybody now is a good time to try and log on to www.kahoot.it because we're going to go to the quiz after we get the answer for this last question from the ladies. What is it that you like least about your jobs, ladies?
I think what I like most and what I like least kind of tie in together. So it's really nice being able to help the patient. Children's lab is a really small lab compared to some of the other really large hospitals. So we tend to get to know the patient's, the patient's name. You kind of see the same sample from the same patient come over and over again. So, I love really being able to help the patient, but part of the job that really kind of is a little bit of a downer, I guess you would say, is that you kind of know that the patients aren't doing well, and that you kind of feel bad knowing that you can do all you can do to help the patient, but that sometimes they're just not doing well health-wise. So that's kind of one of the things that I think is a little bit sad in working in the lab. Obviously there's a lot greater, bigger things that are much happier, but that's part of one of the things that I really don't like is just kind of knowing that that patient is not doing well, and just kind of feeling for those families. I think the other thing that's difficult, working in healthcare is we're open 24/7. So sometimes scheduling can be difficult. We work holidays, we work weekends, we work first, second, and third shift. So sometimes that's challenging, working all the different hours and different days and holidays. So those are kind of my two things that I would say are the things that I like least about my position.
And to add a little bit more on to Katie's too as well, talking about, feeling great that you're helping the patient, but then also knowing when the patients are very sick. In histology for us, when unfortunately those patients pass, we do see the autopsies and the autopsy tissue come through. And you grow, even though you're not with these patients, you grow a relationship with them, like, oh, so-and-so is having another biopsy, or, and you kind of grow a relationship, and it just makes your heart sink when you see them come, some of those names come through on autopsy. So you have a connection with them, even though you're not physically, you physically don't know them. And then the other thing that I would say is difficult in my role as a leader, sometimes is dealing with staffing. So like I said, it's been absolutely crazy the past few weeks. We've had some things happen where some people needed to be out. And you can't really prepare for certain things. And it's just really, it can be difficult, but you learn to adapt and use your resources. And we do what we have to do to take care of the patient. So it doesn't matter if we're fully staffed or critical staffing, we're committed to do what we need to do to get the job done and get it done correct and accurately.
Great. Thanks so much, ladies. A quick question did come in that I'll just ask before we go to the quiz, which is how many hours do you guys actually work per week? Since you brought it up, Katie.
I'm personally full-time, so I work 8 hours a day, 40 hours a week. We do have people that work as little as 2 days a week in the microbiology lab, and people that work, part-time. So we really kind of have all shifts that if you want to work full-time, great. If you want to work part-time, great too. So we kind of have all the options available, at least in the microbiology lab. And I think most of the lab has those options, full-time or part-time.
Wonderful. Thank you so much.
I too work full-time in histology. We don't work on holidays. We do rotate on call weekends. So I rotate through call 1 in every 5 Saturdays from 7 to 11. And we only, we're on call. And so most days, most Saturdays, we don't get called in, but our pathologists do have the ability to call us in if they need something that's critical on a Saturday morning. So.
Okay. Okay, so we are letting people ask questions in the chat. So definitely, if you have questions that you want to ask, do so there. One question came in. I don't know that I fully understand it, but I'm going to send it to you guys, Katie and Nicole. Can you transfer science labs to work in? I maybe it's asking if you can go from one to another area.
Yeah. So that's a great question. And actually, if you work our off shifts, so our second and third shift techs actually work multiple departments every day. So our second shifters work in hematology and chemistry. They retrieve samples from histology, and they work and they do microbiology testing too. So working an off shift is a great way to kind of get your feet wet and jump in and decide what you like, which areas are your favorite. And then I think they also do blood draws, I think too. I think sometimes they do phlebotomy testing on our off shifts. So but during our day shifts, we definitely have techs that are even cross-trained. So they work in multiple departments. And then if there's an opening in a different department, you're more, you can apply for that position and you can transfer. So if there was a histo position open, I could, apply for that position and work in histology if I would get accepted,
Right.
if that would work out. But yeah, there's definitely opportunities to transfer areas from the labs.
Very cool. Okay, great. Thank you. If you have other questions, schools, people who are listening, please definitely send them in. I know you mentioned pathologists, and obviously each of your two roles, but what other kind of staff do you guys work alongside? I think you mentioned physicians at some point as well.
We do work a lot with physicians,
No, go for it.
Physicians and nurses and OR staff. So we work closely with them just because they are the providers that are ordering the testing. And so if we have questions or need clarification, we reach out to them on a regular basis. There's actually in clinical lab, the main lab, histology is kind of its own different animal because it's tissue and it's not clinical. So when I say clinical lab versus AP is anatomic pathology, but out in the clinical lab, in the main lab, they actually have a processing person that actually takes care of and verifies all of the orders coming in. And if there are questions, they have a helper that they are reaching out to those physicians and asking the questions and getting the orders fixed so that they can perform the testing that they need. It's a very, very busy bench. I had the opportunity to observe and watch that workflow. I loved it. It's something I totally would love to do and love to learn. But again, fast-paced, high volume.
Observation is a great way to get an appreciation for what someone else does, whether or not you ever want to go into it.
Yep,
it's
absolutely.
A great way of just getting that appreciation.
Yeah.
I wanted to just ask another question that came through, which was really regarding salary for the different kinds of levels. Do you know, like for an MLA that you mentioned, like roughly what they come in? That's the one you said that just needs a high school diploma. Any idea?
I unfortunately don't know the answer to that. Yeah,
Okay.
I don't know the salary for an MLA position.
Okay. Nope, that's okay. For histology or for the microbiology, is there a rough, you come in no less than this typically?
We really, unfortunately, don't have the information to share the salary ranges, but I would say depending on the amount of education, the salary ranges for each individual position varies. And so I think just as a routine kind of thing is that the more education and certifications you have, the more pay you will most likely receive.
Right.
If that makes sense.
It does, yeah. Experience and education definitely tie into those things. I do know that if any research is just going to Google and saying, average salary or median salary for histologist, histotechnician, microbiologist would give you, and you can even narrow it down to Wisconsin, so you can just get, the market. So that is one way to maybe get the answer for those who've asked that question. Another good question that came through is what happens to the specimens once the testing is finished?
So we have a whole specimen storage policy, so it gets very complicated. But in general, it depends on kind of how irretrievable a sample was. Like Nicole was saying, histology gets a lot of tissues which can't be recollected. So I don't know how long you hold those, but at least for microbiology, we hold those for at least a week. And then sometimes, depending on the sample, we also freeze. Like our spinal fluids are very, you know, not special samples, but just difficult collections. And those actually get frozen, and we hold those for 4 months. And then a urine collection, we only hold for 48 hours. So it really depends on the sample type and also what testing was ordered. So it's kind of a complicated question, but anywhere from, I don't know, 48 hours to 6 months, we save samples. Usually samples don't get tossed right away though. Usually we save them for at least a period of time. Physicians often call back and want to do some add-on testing. So if they ordered one test, they didn't get a result that they want, they might want to add more testing to the sample. So we do really save them as long as we kind of have space for physicians to kind of call and add on testing.
And for us in histology, we keep, our procedure is to keep a specimen a certain amount of days after the pathologist has signed out the cases. So for our cytology cases, it's 2 weeks. For our surgical cases where we have these blocks, it is 30 days after sign out, and then we go through a disposal process. We do keep tissues because we are a teaching facility as well. We do keep certain tissues, hearts, and anything that is interesting, and we can keep those forever because we keep them in formalin. But all of the other tissue is disposed and incinerated. But these blocks and slides that I was telling you about, we have blocks and slides that date back to the 1980s. We don't get rid of anything. And so because we never know what we'll need to go back to for research, our lab accreditation, the College of American Pathologists, only requires us to keep things a certain amount of time. That is not back to the 80s. But we do keep things back to the 80s because that's how we do things here. But being a teaching facility too, we also keep a lot of frozen archive tissue. And so we have freezers full of patient tissue, frozen fresh tissue that we would be able to pull back if, you know, somebody was here several years ago and now they want to pull some of that tissue for testing. In that -80 freezer, when we pull it out, it's essentially as good as the day it was collected, and we're able to perform testing on any of that tissue that we have saved. And since I've been here in 11 years, we've never gotten rid of any of the tissue in the -80 either. So we have lots of things here in lab.
Very cool. Thank you. We have about 6 minutes left and couple of questions. One question that came in was, in terms of technology and its improvement, how do you see that impacting the lab roles? So, you know, in the next, you know, few years. So is technology going to take over to prevent human error that you had, you know, mentioned, or?
I think as far as microbiology, we have a lot of automated systems. So our identification methods and our susceptibility methods are automated. And our molecular PCR instruments, you know, you put the sample on and, you know, you have to process the sample and do some steps before that. But I think, you know, microbiology is very manual, and I think it will stay like that. There's been a ton of technology even since I've started that really have helped improve turnaround time, so you can get, you know, bacterial identification earlier than you used to. But you know, even the automated things that we have, we still have to double check things. So if we get an identification or susceptibility method from our automated system, we still visually need to look at the, you know, the media agar and just make sure it actually looks like that bacteria. So like say, you've probably heard of MRSA with his methicillin resistant Staph aureus. So we still have to look at our plate and say, oh, this just really looked like the organism Staph aureus. And if our susceptibility methods say it's methicillin resistant, you know, we double check that too. So I do think it helps patient care and really helps our turnaround times, but we do really need our automated double check or manual double check, at least for microbiology. So it does help, but I think, you know, human error is going to happen no matter what, you know, what you do. You just can't prevent human error. But I really think that at least microbiology will stay manual for a very long time.
And I believe the same for histology. We do have a lot of automated instrumentation. And one of the great things about children is that they are very passionate about making sure we have the best and upcoming technology to do the tests we need to do. But much like I said, with cutting the blocks and the manual dexterity, I believe that we're never really going to be able to get away from that. There are some things out there, but the old-fashioned way is definitely the best when it comes to that. I don't know that you'll ever be able to have the technology take over. You're always going to need somebody to load things on and take things off and verify that what the instrument did was correct, because that instrument is only as smart as the person operating it sometimes too. And so we check, we recheck, we double check, we triple check in many of our processes.
Wonderful. Thank you. Thank you so much. The last question that came through, and then we're going to close it out for the day, is going to be just really a question about, we have people who are interested in shadowing at Children's, and I know that you guys may or may not have that specific answer, but I did tap into Julie in HR for you guys. And due to COVID right now, there isn't really that opportunity to just come in and shadow. And that's pretty much true at any of the health systems right now, to keep you safe and to keep our patients safe and to keep our staff safe. You know, they're not letting people in just to come in and shadow. Hopefully that'll be opening up in the next couple of months, you know, as people get their vaccinations and, you know, the numbers go down and all of that sort of a thing. But you know, keep your eyes peeled, definitely reach out. Most people do have on their websites shadow opportunity links, and you can go in and search for that on the, you know, Children's website, the Freighter's website, the Ascension website to shadow, and they'll tell you that they're not doing it right now, but to check back. And then you can just keep checking back and then go in, and when it's open, you'll be able to set up time to go in and shadow and get more information. So shadowing is a little bit difficult these days, but it is something that we anticipate and hope will be opening up, you know, sooner rather than later. We thank everyone for attending today's event. You know, we used up the whole hour. We had fun with the quiz, I think, and learned that while Icky, the lab sciences are also super cool, and, you know, give you an opportunity to know that you're helping people, helping the community behind the scenes. Thank you for attending today's event. If you have any questions about this event or about the actual, you know, lab, you can reach out to joan.ward, W-A-R-D, at employmilwaukee.org, and she will get those questions out to the appropriate hospital system or representatives to hopefully get answers to you. Thank you so much for your time, and you guys, everyone, have a wonderful day. Enjoy this Green Wednesday.
Thank you. You too.
Bye,
Thanks,
you.
Katie. Thanks, Nicole.
You're welcome. Thank you.
Bye-bye.
Bye.
Bye-bye.